When you're facing a serious health condition or considering a clinical trial, the healthcare system can feel like a maze. Insurance denials, complex treatment options, confusing medical terms. It's overwhelming, and you might feel like you're navigating it all alone. But here's what you need to know. Thousands of organizations exist specifically to support people just like you. Today, we'll explore how patient advocacy groups can become your strongest allies in healthcare. Patient advocacy is about ensuring your voice is heard, your rights are protected, and you have the support you need to make the best healthcare decisions for your situation. Think of a patient advocate as your healthcare ally, someone who understands the system, speaks the medical language, and fights for your best interests. They level the playing field between you and complex healthcare institutions. Advocacy can mean the difference between getting the care you need and falling through the cracks of a complicated system. So, who provides advocacy? Let's explore. There are professional advocates, trained professionals who work full-time helping patients navigate healthcare challenges. You also have peer advocates, people who've been through similar health journeys and now help others facing the same challenges. And then there are organizational advocates, groups that work to change policies and improve healthcare for entire communities. Patient advocacy comes in many forms, each designed to meet different needs. Understanding these types helps you find the right support for your specific situation. Let's start with disease-specific organizations, providing condition-focused support. Organizations like the American Cancer Society, Alzheimer's Association, or National Multiple Sclerosis Society focus on specific diseases. These groups offer specialized knowledge about your condition, support groups with others who understand your journey, educational resources tailored to your specific needs, advocacy for research funding and better treatments. Because they specialize in your condition, they understand the unique challenges you face and can provide highly relevant support. Then, we have general patient rights organizations, broad-based support. Organizations like the Patient Advocate Foundation work across all health conditions to protect patient rights and provide practical assistance. These groups help with insurance problems and appeals, financial assistance and copay support, understanding your rights as a patient, navigating healthcare bureaucracy. You also get clinical trial, advocacy, research-focused support, organizations specifically dedicated to helping patients understand and access clinical trials. They provide education about clinical trial options, help finding trials that match your condition, support throughout your trial participation, advocacy for better trial design and access, your temperature and pulse, quick checks to ensure you're not fighting an infection and your heart rate is normal, your weight. Many studies track weight changes, as some treatments can affect appetite or metabolism. These measurements help researchers track your overall health during the study, detect any changes that might be treatment-related, ensure your safety throughout your participation. And lastly, we have community and demographic organizations, population-specific support, groups serving specific communities such as pediatric advocacy for children and families, organizations focused on elderly patients, groups serving underserved or minority communities, LGBTQ+ health advocacy organizations. These organizations understand the unique challenges faced by specific populations and provide culturally appropriate support. Advocacy organizations offer an impressive range of services, often at no cost to you. Let's explore what these groups can do to support you and your family. An important one being educational resources and information. Reliable, understandable information. Advocacy groups translate complex medical information into language you can understand. They offer disease-specific educational materials, treatment option explanations, webinars with medical experts, online resource libraries, Q&A sessions with specialists, and patient navigation services, which provides personal guidance through the system. Patient navigators are trained professionals who help you understand your options and coordinate your care. Navigation services include help preparing for medical appointments, assistance understanding treatment recommendations, coordination between different healthcare providers, support in making treatment decisions, follow up to ensure you're getting appropriate care. Then, there's the all-important financial assistance and insurance support counselors. Practical financial help. Many advocacy groups offer direct financial assistance and help with insurance challenges. Financial support includes grants for treatment costs, travel or living expenses, copay assistance programs, help with insurance appeals and denials, guidance on accessing pharmaceutical assistance programs, financial planning for long-term care costs. And don't forget, emotional and peer support. Support groups and peer mentoring connect you with others who truly understand your journey. Emotional support includes in-person and online support groups, peer mentoring programs, family counseling and support, crisis intervention services, grief and bereavement support. If you're participating in or considering a clinical trial, advocacy groups provide specialized support throughout your research journey. Pre-trial decision support helps with education and decision-making. Advocacy groups help you understand clinical trials and make informed decisions about participation. Pre-trial support includes education about how clinical trials work, help searching for appropriate trials, assistance evaluating trial options, support in discussing trials with family, guidance on questions to ask research teams. There's also during trial advocacy, ongoing support and rights protection. Throughout your trial participation, advocacy groups ensure your rights are protected and your needs are met. During trial support includes understanding your rights as a research participant, help communicating with research teams, assistance resolving problems that arise, support for family members during your participation, advocacy if conflicts develop with the research team. Then, it moves into transition and post-trial support, continuing care planning. When trials end, advocacy groups help you transition to appropriate next steps. Post-trial support includes help accessing continued treatment if trials end early, assistance transitioning back to standard care, support finding other trial opportunities, help with insurance coverage for post-trial care, long-term follow-up and monitoring support. With thousands of advocacy organizations available, how do you find the ones that can best help your specific situation? Online research. Start with searches like Your Condition Advocacy, Patient Support Your Condition, or Patient Advocate Foundation. There's healthcare provider referrals. Ask your doctors, nurses, or social workers about advocacy organizations they recommend. Healthcare providers often work closely with advocacy groups. And local resources. Check with hospitals, community health centers, and local health departments for advocacy organizations serving your area. Evaluation criteria. To consider services alignment, look for organizations that provide the specific types of support you need, whether that's education, financial help, emotional support, or clinical trial guidance. Credibility. Assessment. Research the organization's background, staff qualifications, funding sources, and reputation in the healthcare community. Patient feedback. Look for testimonials from other patients and families who have used the organization's services. When contacting potential advocacy organizations, ask, what specific services do you provide for my condition? Are there any costs for your services? How do you protect my privacy and personal information? What support do you offer for family members? How quickly do you typically respond to requests for help? Can you provide references from other patients you've helped? Once you've connected with advocacy organizations, here's how to build effective relationships and get the support you need. Come prepared. Have basic information ready about your condition, current treatment situation, insurance status, and what kind of help you're seeking. Be open and honest. Share your concerns, fears, and challenges openly. Advocacy organizations have experience with all kinds of situations and are there to help without judgment. Make sure you understand what the organization can and cannot do, and what realistic timelines look like for different types of assistance. Establish communication. Determine how and when you prefer to communicate: phone, email, text, or in-person meetings. Stay connected. Keep your advocacy contacts updated on changes in your condition, treatment, or needs. The more they know, the better they can help. Provide feedback. Let the organization know what's working well and what could be improved. Your input helps them serve you and future patients better. Patient advocacy isn't just for patients, it's also for the families and caregivers who support them. Many organizations provide specific resources for family members. There's caregiver-specific support, education and training, programs that help family members understand the patient's condition, learn caregiving skills, and understand treatment options, and caregiver self-care. Resources to help family members take care of their own physical, emotional, and mental health while supporting their loved one. Here's some family communication and decision-making advice. 1. Communication support. Help for families in discussing difficult topics, making medical decisions together, and managing disagreements about treatment. 2. Supporting all family members. Special resources for families with children, including age-appropriate ways to explain illness and involve children in family discussions. 3. Financial and practical support. Help understanding the financial impact on families and accessing resources for lost income due to caregiving, travel and lodging for treatment, childcare during appointments, home modifications for patient care. The most effective advocacy often involves building a network of support that includes multiple people and organizations working together. Your advocacy team, professional advocates, patient navigators, social workers, and advocacy organization representatives who provide professional support. Personal advocates, family members and friends who can accompany you to appointments, help with research, and provide emotional support. Healthcare advocates, doctors, nurses, and other healthcare providers who advocate for you within the medical system. Coordination and communication tips, information sharing. Establish systems for keeping all members of your advocacy network informed about your condition, treatment, and needs. Regular check-ins. Schedule periodic meetings or calls with key advocacy team members to ensure everyone is working together effectively. Here's how to develop self-advocacy skills. Personal empowerment. Many advocacy organizations offer training to help you develop your own advocacy skills and become more effective at advocating for yourself. Family advocacy training. Programs that teach family members how to be effective advocates and support your advocacy efforts. Let's look at how advocacy has made real differences in people's lives. Stories that show the power of having support when you need it most. Insurance appeal success. Sarah's story. When Sarah's insurance denied coverage for a specialized cancer treatment, a patient advocacy organization helped her appeal the decision. With professional support in gathering medical evidence and writing the appeal, Sarah's treatment was approved, and she's now cancer-free. Marcus's journey. Marcus couldn't find clinical trials for his rare condition through online searches. A research advocacy group connected him with specialists and helped him enroll in a trial that led to significant improvement in his symptoms. The Johnson family. When their son was diagnosed with a serious condition, the Johnson family faced overwhelming medical bills. An advocacy organization helped them access grants, copay assistance, and insurance appeals that reduced their costs by over $50,000. Dorothy's experience. At 78, Dorothy felt overwhelmed by her complex treatment plan involving multiple specialists. A patient navigator helped coordinate her care, prepared her for appointments, and ensured she understood her options, leading to better outcomes and reduced stress. Ready to connect with advocacy support? Here's how to take action and find the help you need today. Patient Advocate Foundation provides case management and financial assistance for patients with chronic, life-threatening, and debilitating illnesses. Call 1-800-532-5274. National Association of Healthcare Advocacy connects patients with professional advocates and provides advocacy resources nationwide. Cancer Care, free support services for anyone affected by cancer, including counseling, support groups, and financial assistance. Find your organization. Search for Your Condition Foundation or Your Condition Society to find specialized advocacy groups for your specific health situation. Online resources, advocacy directories, websites like healthadvocate.org and patientadvocate.org help you find advocacy organizations specific to your condition and location. Hospital resources. Most hospitals have patient advocacy departments. Ask about their services and local resources they recommend. Start today. Don't wait until you're in crisis. Many advocacy organizations can help even when things are going well, and establishing relationships early makes support available when you need it most. Be prepared. Before contacting advocacy organizations, gather information about your diagnosis and current treatment, your insurance information, specific challenges you're facing, what kind of help you're seeking. Facing a serious health condition or navigating clinical trials doesn't have to be a lonely journey. Patient advocacy organizations exist specifically to ensure you have the support, information, and resources you need. Whether you need help understanding your condition, fighting insurance denials, finding clinical trials, accessing financial assistance, or simply connecting with others who understand your journey, advocacy organizations are there to help. Remember, advocacy isn't just about solving problems. It's about empowering you to make informed decisions, protecting your rights, and ensuring you receive the best possible care. Your health journey is unique, but you don't have to travel it alone. Patient advocacy organizations are ready to stand with you, fight for you, and support you every step of the way. Reach out today. Help is available, and you deserve to have advocates in your corner.